So we're going to quickly talk about a number of different models of, explaining trauma disorders and, think about what kinds of models are going to be useful for us here and certainly not useful. From the medical model, we're thinking about a medical or biological problem. So, for example, Aaron Hernandez's brain atrophy and ventricular enlargement, or people with dementia and who may have unhealthy neurons or changes at the neurotransmitter level. We're seeing problems in terms of, what's happening hormonally, in the HPA axis, hypothalamus, pituitary, and adrenal. And we know that one of the things from the medical model is that we're saying these things cause this, cause dementia. Second approach is that of the family therapy perspective. From the family therapy perspective, we're saying that the individual cannot be understood in isolation. They're affected by the people, by the context. And in order to understand this, we have to understand the rules, structure, and organization of the family. And all families are somewhat different there. In or from this perspective, the system is dynamic, that is changing, and influenced by other kinds of factors. The effects are bidirectional. What happens with mom affects the child, which affects mom. And the system, the family system, can either stress or support a person. So if we're thinking about what's causing the problems with these two children, we can certainly think about family stress, or problems in the family getting along together, mental illness in the family, the child feeling alone and isolated. In the family systems model, we're thinking about an identified patient, or, which is often referred to as the IP, who is the reason that the family enters a therapy, but not the only problem. As a result, the structure of the family should be addressed, often with the whole family present. Now, if we are failing to recognize and acknowledge systemic issues, then we're likely to blame the child for problems. And I think, that is a problem, and one that we're trying to address with the trauma-informed model. So let's think about it in terms of Emmy Needfield. Emmy was 14 at the point that we're talking about here in her memoir, called Acceptance. And this is how we might draw a genogram for her family. So these are her two parents. Her mother has a lot of mental illness, as does her other parent, who now identifies as trans. When Michelle began or came out as trans, she broke off her contact with Emmy and with the entire family and moved across country. Her other parent identifies as a genius, but also significantly cords. So there are paths through the house. Her bed is covered with boxes. And while her mom seems to love Emmy, there's also a lot of conflict around these issues. Emmy is at this point describing a history of eating disorders, 4 prior hospitalizations, chronic suicidal ideation. Think about how knowing this changes the way that you might see Emmy. And also think about how many aces you see and what aces you see. So let's think now about the biopsychosocial model. From the biopsychosocial model, we're saying that there are biological factors, social factors, psychological factors that all play out and may be impacted by trauma. The trauma may impact activity of the genes or the expression of the genes. It may influence relationships, for example, between Emmy and her mom. And it may impact how she sees herself, that Emmy sort of believed many of the things that her mom believed about her. Now, a fourth approach is kind of a radical one, but I think we should think about it, and that's the approach of the anti-psychiatrists. Thomas Szasz argued that mental illness does not exist, that this is a label used to control people within our society. Another anti-psychiatrist, again, both Szasz and Lang are psychiatrists. Lang argued that mental illness is a reaction to unbearable stressors in life, which is a very different perspective than the medical model, and also is pretty consistent with what we're talking about in terms of trauma-informed care. I am going to stop here, and I will see you in the next video. Take care. Bye-bye.